Hey, Arman here, and in this video we're going to talk about methods for checking arterial blockage for coronary artery disease. So, I work with people who are older, and I'm 60 myself. So if you feel like you got elevated readings of cholesterol and things you're concerned about, or you just want to make sure that, to see if you have any blockage in your arteries, then these are the different techniques that you can consider. Again, talking to your medical professional and learning what the ins and outs of each of them are. It can be helpful to find if you have blockage, and if you do, then look at what the strategies are going to be to help alleviate it or improve it one way or another, either through medication, obviously through nutrition as well, and exercise will help too. So one of the easiest ones and the oldest ones, in my opinion, would be the stress test, where basically you get on a treadmill or a bike and you do a kind of a slow speed. So you also have to take some dye with this, and this dye starts floating around in your bloodstream as you're moving around because you're generating activity. And then what they do is they can check where the dye is going and see if there's any blockage. So that's a pretty standard test. It's I don't know why they don't use it more often, but they don't. So, but if you ask for it and they can do it, then you'll know. But they also can use, if you don't want to do a bike or a treadmill, then you can do a pharmacological or medication. You can take that, and again, they can monitor where that chemical is going into your arteries and see if there's any blockages. So that's really the purpose of that. And it can be really helpful if you find some blockage. Then you get on the offense, because the last thing you really want to do when you're dealing with this kind of stuff is to be cut on. Having a surgery, because that stuff is hard on your system. And like my father-in-law had it done, and he had a quadruple bypass because he had blockages after they did a stress test on him. It was not good, and ended up, when he got done, he was still alive and everything, but his ejection fraction, which is how you're pumping your blood, it never came back up, and it was pretty much done after that. He did last for about 18 years after having that done, but his quality of life was not good. The last 5 or 6 were horrible. So you want to avoid surgery, in my opinion, at all costs. Try to find other solutions. So getting these tests done can help with that. A coronary angiogram. And again, you have to talk to your medical professional about it. I'm just here to kind of enlighten you of the different options that are available so that you can have potentially a more quality conversation with your, if you're dealing with a cardiologist or something like that. But this one, they inject the dye. So this is more invasive, as they call it. They inject the dye into the arteries, and then they take X-rays to see where it's going. So that's an option there. And then you get the feedback from that, and if it comes back clear, then it's all good. A computed tomography angiography, also known as CTA, I guess. And this uses computer and X-ray technology to kind of see how blood flow is in your system. So that's a good option too. Again, depending what the situation is, the cardiologist will have some preferences on that. But you have to you just want to know what your options are, because you may prefer one over the other. Then we have magnetic resonance angiography, known as an MRI. So we're going to use magnetic fields and radio waves to track how the blood's flowing in the arteries. So that's another option there too. And then finally, this one's become a little more popular, is a calcium score test. So with this one, they're going to do an imaging to assess the calcium deposits and to see if there's anything in there. And if you get a really low score, then that means you're good to go and you got a good bill of health. So all these things are going to give you feedback if you got calcium buildup in the arteries. And then after that, it's just a matter of, okay, what is going to be the strategy to improve this and not have to go through a surgery where they got to cut you open and create all kinds of other, it's just going to shorten your lifespan. So we can do a lot of other things if we get on it ahead of time. So if you feel like historically your cardiovascular disease is a problem in your family, then these are some of the tests that you want to consider to see where you're at. Because once you know where you're at, now we get on the offense and figure out what we're going to do as a team to get this thing under control. All right, so hopefully this was helpful. If you have questions on this, again, you can pop the questions into the group and we can talk about it more. But other than that, we'll see you in the next video. Take care.